Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. Trying to find the right physical therapy location can be a little bit daunting. Usually if you go to the doctors, they'll give you a big list of these are the people that we like that can provide care for you. And how do you choose from that list? Or if you just need to go out on your own and find something, how do you find the right PT location for you? In today's episode, I'm going to try to demystify things that you should look at in terms of how to find the right PT location for you. So we're going to talk about questions that you need to ask yourself first before you find the location, questions you should ask the location, and then the value the different types of practices bring. I want to first tell you what kind of practice I have here in Southern California. It is a cash-based practice. That's what they call it. That doesn't mean you need to have cash to come see me, but it means that payment is due at the time of service and payment in full. I am out of network for all insurances, so I don't take insurance. But I do submit to your insurance for you so that possibly you get reimbursement. I can only do that if you have a PPO, and we'll talk about PPOs and HMOs in a second. The appointments are an hour long. They're one-on-one with me, and I don't have any aides. So it's not like you're going and spending 15 minutes with me and then doing a bunch of exercises. It's an hour one-on-one, you and me. And I usually see patients about once a week. Now, if someone's really acute and flared up, I might see them twice a week, but usually it's one time a week. That's the kind of practice that I have here. So let's talk about first what sort of questions that you should be asking yourself before you're trying to find a physical therapy location. It might seem crazy this is the first question to ask, but insurance. Do you need to have a place that will take your insurance? Healthcare can be very expensive. And so you need to kind of figure out if it's really something important to you that you need to see someone that takes your insurance. Now, with that, you need to figure out if you have an HMO or a PPO. Insurances are extremely confusing. There's a lot to them. And so I'm not going to dive too much into this because that is probably 3-4 episodes on itself about how to deal with insurance. But we're just going to break it down just a little bit. So if you have an HMO, like here in California, Kaiser is an HMO. Kaiser, it's kind of like a one-stop shop. Everything you need is in that one big building. Any, inpatient hospital services, outpatient services, they're all right there. Now, the nice thing about Kaiser or an HMO is that you usually don't have to pay much for the services, if anything at all. And with that means, though, that you're very limited on who you can see and when you can see people. So it's very regulated, and that's how they keep their healthcare costs down. So if you have an HMO, you're going to have to either just go to someone that's right there in that provider, or you're going to have to go outside of that. And if you go outside of that, that's usually on your own. Very, very rarely do HMOs cover anything that's outside of their medical practice and what they have. If they do cover it, it's usually because they don't have anyone with that specialty in their system. But with physical therapy, they have physical therapists, and they don't see necessarily that a special type of physical therapy is what's needed and that they don't have that specialist. They kind of view physical therapy as one big lump. So most likely, if you have an HMO and you don't want to go to that provider, then you're going to have to go out of network and it's going to be on your own. Now with a PPO, you have more options. You have different providers all over the place, and those are providers that are contracted through your insurance company. You can usually find those online. You can find providers who will take your insurance plan specifically. That's all online. And with that, it's great. You have more options and you can go to someone in network. You can also choose to go someone out of network. Like I said, I'm out of network for all insurances, so I'm not contracted through any insurance company. My rate is my rate. And with that means that I can still submit to people's insurance for them, but it might not all be approved. And it might have to go towards their deductible first before they get any sort of reimbursement. These are all questions that you can ask your insurance provider. You can usually find the information online on the website under your specific plan, but you can also call them as well, just kind of figure out what are your benefits for physical therapy in network and out of network and deductible, and just get some more information from them on there. Or you could have Medicare. Medicare, your options are also limited. You have to go to a Medicare provider. And those people are specifically contracted. It's a different kind of system you have to go through to become a Medicare provider. So a little bit more limited with Medicare as well. So PPO is pretty much your more like open option for finding a physical therapy practice. But you need to first kind of figure out what type insurance, if you need to use insurance, and what type of insurance do you have? And that will kind of help dictate where you're going to go. Now, if you don't need to use insurance, or maybe you're going to use insurance part of the time, we'll kind of talk about that in a second in terms of different type of practices and what you can do. You can kind of pick and choose, but you just kind of need to figure out if insurance is really important to you and then go from there. The second question to ask yourself is, what type of injury do you have? What you're going to need for therapy is very different depending on what you're going into therapy for. So if you're post-surgical, so if you just had surgery, you're going to require a lot more physical therapy in those early months than you will later on. And you're going to need a lot more oversight with your exercise progression. So every surgeon has a protocol that they want the therapist to follow in terms of how much range of motion they can do until a certain time, and then what type of exercises they want to focus on. So those first couple of months, you're going to need a lot of PT. This is when people are going to 2 to 3 times a week. They're going to physical therapist to kind of get that oversight for what the doctor wants in their post-surgical rehab. So just realize that if you are post-surgical, you'll probably want to go to a provider because you're going to be going through a lot of different sessions. And so you want your insurance to cover it as much as you can, especially since you just had surgery and that probably went towards your deductible anyways. So you're going to get more reimbursement back. So I would say if you're post-surgical, go to a place that's in network for you, because it's not as specific in terms of what you need, or you don't need anything special all the time. You just need someone that's going to be able to follow along with the protocol and kind of see you through that progression to make sure that you are healing well after the surgery and making it kind of those milestones that the surgeon wants you to be at. Now, what if you have a non-surgical injury? So first you have to figure out what is the severity of the injury. Is it something that's really bad, or is it something that's really mild? If you sprained your ankle really badly and, were in a boot for a while and having to walk around, that's going to be a little bit more of a severity of the injury than, say, if you kind of tweaked your neck a little bit and then just woke up and your neck was a little kinked. That's a little different in terms of what your needs are going to be. You also want to think about if there's a specific area of your body that got injured, that you're going to need to find somebody that specializes in that potentially. So like physical therapists don't really do a lot of work with patients with hands. That's more occupational therapists. And you want to go to a hand specialist then. Hands are very complicated. There's a lot going on there. And so people really do specialize in that area, usually more in OT or occupational therapy. So you need to know what part of your body. Or like the foot can be very complicated too. So you might want to see someone that has more work that they've done with the foot. Or you could have different like concussions. There's a lot of more therapy that's being done for patients that have had concussions, physical therapy. And so you want someone that's worked with a lot of head traumas and understands that whole component. Same thing with vestibular. So vestibular is like your ears and kind of your balance. So if you're someone that has had balance issues, or you have something like vertigo, you want someone that's going to be a specialist. So you need to kind of decide that, is this more of a general injury that you can see just, any physical therapist, or is this something a little bit more specific that you need to have someone that specializes in that area? See, all questions to look for, because it makes it a lot easier to look for a PT when you know what exactly your needs are going to be. So understand the type of injury that you have, and that will be easier. Now, what about how long has the injury been going on for? If it's something more like chronic pain, then you're probably going to be needing someone that's going to find the root cause of the pain. You're going to need a more highly skilled practitioner. And with that usually means you're going towards out of network, someone that more like a cash-based practice like I am. You've probably been through a lot of other PTs and other practitioners if you're at this point of more chronic pain. So you want someone that's going to be more discerning. So you're going to look for people that have more specific certifications, people that have a good reputation. And luckily, there seems to be people that have chronic pain. There's a lot of help groups out there. There's a lot of support groups. And within those support groups, they do share information of practitioners that have been helpful for them. So you might need to try searching out people in those help groups that you have, those support groups, to be able to figure out who's somebody that has been able to help the other people in the group to get more to the root cause of the problem and really bring more of a solution to the injury that they have going on, rather than going to someone that, you just kind of find in the yellow pages, or you just hear from just a general practitioner or general doctor. You want to have someone that people know about. So kind of review the questions that you should ask yourself. You need to know if you need to take insurance and what kind of insurance you have, what type of injury you have. So that means, do you have post-surgical? Is it a non-surgical injury, but is it something that's more of a specific area that you need to find a specialist in? And if you have chronic pain, you're probably going to want to find someone that can really dive down deep into the causes. All right, so now when you have a better outline of where you need to go, or kind of the practitioner that you're looking for, you need to start finding the location and start asking location questions. Now, it always surprises me how people will just have found me on a Google search, and they'll put in things saying like, hi, my doctor says I need PT. And when I talk to them, they have no idea as to what's going on. There's questions to ask. They kind of view that PT is a catch-all, that it's everything, that they think you just kind of show up, you do exercises and gone. There's a lot of different aspects that come to physical therapy, and that's what we're talking about today, is the different type of PT practices and finding the best one for yourself. But realize that when you call a location, you should be asking questions to them too. You need to understand what kind of location they are and what sort of services they'll be providing. So please, when you call a physical therapy practice, you need to start asking some questions and have a list of ones. So here are a few questions I think are important. First of all, insurance. Do they take yours? Sometimes the people don't update their website as much, or the insurance company might be a little behind on the times. There's a lot of shuffling around of when people are contracted and when people are not. Or if it's a big PT practice, maybe only a few of the PTs are actually contracted through your insurance and not everyone. So you first want to find out, do they take your insurance, if that is something that's important for you? Like I said, you can look online on your insurance company website to get an idea of who probably does take your insurance, but it's always good to ask too, because there might be some changes that have occurred, or maybe it's only part of the practice that actually takes your insurance. Now you need to ask, who will you be seeing? Are you just going to be seeing a physical therapist? Are you going to see a physical therapist and a PT aide? Or what about a PT assistant? There's a difference between an aide and an assistant. Assistant can do more. PT assistants can pretty much do everything except for the evaluation. The initial evaluation when you come in, needs to be done by a physical therapist, and then they can be passed off onto a physical therapy assistant that can kind of follow your progress and be checking in with the physical therapist. Now, a PT aide is just there to kind of go through some of the interventions, and so depending on the state, they might be able to do the ultrasound for you, or they're going to be running you through exercises. So you want to ask, well, who will I be seeing? Am I going to be seeing just the physical therapist, or there's other people involved with the care too? Now, another thing that people don't usually realize that can happen, and it's important to ask this, is, are you going to be assigned to only one physical therapist, or is it going to be possibility you're going to be split between multiple therapists? Now, sometimes that is an issue with your schedule, that maybe you can only go certain days and that physical therapist isn't there both days, so you might be split between two. But it also happens that they'll just start kind of scheduling you with other therapists. So you want to find out, is it that you're going to be with one person and one person only? I mean, obviously there's things that happen. Maybe that person has to cancel last minute and you have to see somebody else. But are you assigned to just one, or are you going to be most likely seeing multiple physical therapists? Because that's something you kind of take into consideration. Do you like that idea of seeing multiple physical therapists? It can be a good thing, a different set of eyes on the situation, someone else kind of looking at what's going on. Or sometimes it's not great, where you need someone that's going to be checking in on that kind of incremental improvements, understanding those milestones, because there's only so much that can be written in a note, right? The little nuances of how someone's doing is better done when it's just one person seeing you. But sometimes it's not good just to have one person. Like I said, there's multiple different pros and cons to having one therapist compared to multiple therapists. So I would ask if you are going to be assigned just to one PT, or is it going to be more like you're going to be scheduled between multiple physical therapists? I don't suggest a place that's going to have you in two or more. Like 2 therapists is fine if you're split between 2. But if you're going to end up seeing possibility of a 3rd therapist, the continuity of care just isn't great there. So I possibly wouldn't go there. I would say that 2 is your max in terms of who you could be split between. Next to ask is, how long are the sessions? And are they the same every time? So my evals and my follow-up appointments are all an hour long. Everything's an hour long. Some practices, the eval might be 45 minutes or it might be an hour, but then all the follow-ups are half an hour. So you need to understand how much time are you going to be there. Along with that is how much time do you have with the actual physical therapist? Now, this is where my annoyance with insurance comes in sometimes, because insurance dictate how much time you will get reimbursed as a therapist for seeing a patient. So sometimes you're only going to see a therapist for 15 minutes. So even though your appointment is half an hour, or maybe sometimes even an hour, it's only going to be 15 minutes with a therapist and then 45 minutes or, the rest of the time with either an aide or an assistant, somebody else. So you want to find out how much one-on-one time are you actually going to be getting? Because there's a big difference, right? Between an hour one-on-one with your therapist that's going to be able to do everything with you, or 15 minutes with a therapist and 45 minutes doing exercises in a gym. So you kind of want to get a better idea of how that time is split up. How long is the time? And then how is it split up from there? Because there's also some places I've worked at where patients will literally be there for like 2 hours plus, where they see the therapist for a little bit of time and then they're off doing exercises. And because they just have so many exercises and things to get through, they're going to be there for a while. So you need to understand what's going to work best with your schedule, because if you're busy and have to get back to work, it's probably not going to work out well to have a place that midday you're going to be spending 2 hours in. Unless your boss allows that, and then congratulations. But that's not the case for a lot of people. Next question you want to ask is, what is the setting of it? Is the setting in a gym? Are you going to be in this kind of gym area doing all these exercises? Are you going to be in private rooms? And then, or is it going to be like this big open area where all the tables are out there? So it can be that you have a place where the treatment done by the physical therapist is in a private room, and then you go out to a gym-like setting doing exercises. The whole time might be stuck in that private room. Or it could be that there's a lot of tables set up out in an open area and everyone's kind of getting treatment out there from their physical therapist and then going into the gym setting. If you have an injury where you might need some pelvic floor work or something that seems a little bit more that you want to have privacy, then you're probably not going to be in that open gym setting. You're wanting to have a place that has private rooms. So kind of find out a little bit more of what the setting is of the practice, what you should be looking forward to when you go and arrive there. And finally, do they specialize in any area of physical therapy? Is it something that they are very well known for, especially your particular practitioner? Is it something that you can look up a little bit more to understand if that is going to be the right fitting for you? So I would ask if there's anything they specialize in as well, and you can do some more research prior to your first appointment to see if that's something that makes sense for you, or is it something you're like, I don't know if I really need that. So to kind of review, the questions to ask the location is, do they take your insurance? Who will you be seeing? Will you be assigned to like one therapist or multiple therapists? How long are the sessions? And within that session, how much time is spent with the actual physical therapist? What kind of setting are they in? Kind of what's the environment of the practice? And then finally, if they specialize in any type of physical therapy. All right, let's talk about the different types of practices that are out there, because you might be like, okay, this is a lot of information, but what is the difference? What's out there? Well, you could have a place that has a big PT practice where they see a lot of patients. So this is kind of a big outpatient, or sometimes hospitals will have this too, and it's still an outpatient setting, but it'll just be a big area. Now there's lots of machines, lots of equipments. The feeling in these places are usually pretty upbeat and fun because there's a lot of different personalities out there. There's people cheering on. They're kind of struggling with stuff, but you'll get aides and PTs that are really kind of happy and trying to be the cheerleaders for these people. So it's usually more upbeat and fun. There's usually music playing. There's a lot going on. This is better for people that like other people to be around, that they're a little bit more of an extrovert. They like to see more people around. They like to feel pushed. They want to have kind of that interaction with other people to see the progress that they've made or get encouragement as they need to. Now, just realize that if you're in these kind of big PT practices where it's these big open locations, you're not going to get as much one-on-one time. So just be aware of that. But this is great for people that, it's not a big injury that they're going through. It's something a little bit like less severe where they need someone that's more specialized. But then also too, this is great for post-op, where you just need someone cheering you on as you're trying to do those exercises and get those muscles firing again too. So there is a place for these big PT practices that work out really well, but just realize that it's a lot of energy. So if you're someone that's a little bit more introverted, probably not the best place for you. You might do better in a smaller practice where it's a little bit more calm. These areas are a little bit more like boutique practices, and they specialize in certain areas. So there's a lot of more, especially in California, these more smaller practices that are coming out that really specialize in doing like yoga or Pilates as part of the exercise program. So not so much this big gym equipment that you would see, like at a Planet Fitness or a Gold's Gym, but more of like the Pilates and yoga mats and that sort of equipment in through there. This you're usually seeing the physical therapist sometimes the whole time, sometimes for part of the time. And then there's different aides and assistants that are there to do the exercises. Or the physical therapist might actually be a teacher, a yoga teacher or a Pilates teacher, and they're going to be running you through the exercises as well. So this is good if you like to stay with more than just stay with one physical therapist. It's better if you just kind of need a little bit of a quieter setting to be able to focus on what you're going through. There's a lot more privacy usually with these smaller practices because you're going to have more of those private rooms going on. And they're really good for people that kind of specialize in one area. So if you have an injury that's a little bit more specific that you need to have someone that's really good at the one area, these smaller practices are usually where you're going to find them. They're a little bit more calm, a little bit more higher skilled practitioners as well. The last kind of one place is cash-based practice. So that's what I have. In the cash-based practice, you have to be good at what you do if you're asking people to pay cash. There's a great therapist that I have taken classes from, Jack Stagg, and he was saying that if you're a cash-based practice, you better be on the top of your game because you're asking people that could go to someplace that will take their insurance, and you're asking them just to pay out of pocket. So you better show results. So if you're going to a cash-based practice, you're usually getting more one-on-one time. The person has a lot more accreditations, a lot more training, that get a lot more results in terms of kind of faster response and just a little bit of a different way of looking at this. The nice thing about cash-based practices too is that you're not dictated by insurances. So the insurance company really dictates what physical therapists can do, and it's really sad to see. But, as I can understand as a practice owner, that if I was a place that took insurance, I would need to make sure that I could get as much money from the insurance company as I can because reimbursement rates are awful. And yet again, that is a whole other conversation to have, but physical therapy practices really aren't getting much money back when they're seeing these patients if they're going through insurance. So they need to be able to put in as many modalities and put as many billing units as they can so they can stay afloat because they want to help people, but they want to help people and take insurance at the same time. So it's a hard balance to try to make. But if you're a cash-based practice, I'm not going by what the insurance company dictates. I'm going by what is best for the patient. So patients that have more kind of these chronic pain or these weird things that just haven't been able to get figured out, you're probably better going to a cash-based practice. And I understand it's a lot of money up front, but you have to realize that if you have tried so many different other avenues and haven't gotten results, it might be time just to put more money up front to try to see those results. Now, like I said, because someone's asking you to pay cash for it, they better be on top of their game. So you can hold them to a higher level of scrutiny if you're not getting better or not. Patients will make big gains, but maybe not the gains that they're looking for. And they have every right as a customer to say, hey, I thought I would have been able to do this by now. Like, why aren't we able to do this? So you're able to ask a lot more when you're paying for that money, for paying for that service. So just realize that cash-based practices, you're going to be able to get more and you're not going to be dictated by insurances. It's going to be able to do what's right for you. And especially if you're a complex case, I think this would probably be a better place for you to be. Now, nothing says that you can't go to multiple settings at the same time. So I have patients that can't afford to see me full time, that it's too much of a financial burden for them. And so what they'll do is that they'll see somebody else and then they might come see me once a month. Or I have people that fly in to see me like once a year or twice a year and kind of get a tune-up. And then I email back with the other therapist and I'm collaborating. So you can see multiple people at one time. I have people that are post-surgical that I saw before surgery, and then they need to go to someone that can go through that progression that the doctor wants them to go through, but they want to have check-ins with me maybe every other week, maybe once a month, so that we can kind of get into fine tuning in some of those areas that need to be addressed more from a specific type of therapy than what can be provided in that other outlet. And that's a great option for people because you can get the care through your insurance, some place that takes your insurance, but then also get that higher skilled care too. So don't just think that it has to be one or the other. Or it doesn't have to be that you go to cash base. You could go to one of those smaller boutique places for some things. But then if you really just need time and someone to progress your exercises, you might want to go to one of those bigger PT practices. That's a little bit more open gym environment. So just realize that, you're the customer. They're trying to make you happy and you need to get what's best for you. So you can kind of mix and match and juggle in through there. I know it seems like they think that you can only go to one place, but when it comes to physical therapy, you can kind of mix and match as you want so that you get the best care that you want, because ultimately it's about you and getting you back to where you want to be in life. So I hope today's episode helped kind of demystify how to find a PT practice. And maybe I even blew your mind a little bit more as to what all the different options are out there. Because a lot of people, I think, just think it's the big gym setting. And they're surprised when they come into my office and it's just a single room with me and them doing all the work right there. So just be a good customer, figure out what you need first, then find out from the location what they provide, and just try to find the best location for yourself so you can get back to optimal function. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.